One of the questions that we've got here is around day and night reversal and how to swap it back. So could you say something about that?
There's a lot of things that could be going on there.
Yeah.
So what we would want to know is someone's age, whether it's a recent thing. Has stuff changed in the family or in the environment recently? Has there been a new sibling who's arrived, or has someone left home? So might there be cues that were there before that have now changed? It could be especially for someone with sensory sensitivities, that actually the nighttime is the best time. And we saw that quite a lot because it's quiet, there's no one around, so there's no kind of social demands being placed upon you. It might just be the best time to just sit, relax, do your own thing. There might be other things happening. There might be gaming happening. It's really hard to compete with computer games, and it's really hard to compete with phones. They're designed by a different kind of psychologist who kind of works out what's the best way to keep someone using this device for as long as possible.
Yes.
It's, you know, they're very good at what they do. So with devices, we wouldn't recommend necessarily doing it cold turkey. With everything, we'd kind of say, okay, let's gradually reduce it and let's replace it. Let's replace it with something else. So what's that person's special interest? Okay, so they like this thing. So let's do something that involves that doesn't involve so much looking at screens. It's also about the daytime. So the day-night reversal is kind of making sure that the day is filled with enjoyable activities. So what are that person's values? What's important to them? How could you motivate them to kind of be active during the day? We know some young people just don't really like being out in the sun, and you know that's their choice, but it does make it really hard for their brain and for their body to know, oh, it's time to be awake, it's time to be asleep. So we talk about the nice German word Zeitgebers, time givers. So these are the things that cue us into being awake and being asleep. And the strongest one is light. There's others though. There's kind of social interaction, meal times, physical activity. So trying to work them into the daytime as much as possible so that there's less stuff happening at night to confuse the brain and body about day and night timings.